Wait. Before you reach for that innocent-looking piece of fruit in your kitchen, you need to hear this. I'm about to share something that could completely change how you think about fruit after 60. What if I told you that the apple your doctor said would keep you healthy, the banana you grab for potassium, or even those antioxidant-rich berries you've been adding to your morning routine could actually be working against you if you're not eating them the right way? Now, before you panic, I'm not here to scare you away from fruit. Quite the opposite. I'm here to arm you with the knowledge that 90% of seniors don't have knowledge. That could be the difference between thriving in your golden years and struggling with preventable health issues. This Senior Healthline, your trusted source for evidence-based health guidance designed specifically for the over 60 crowd. In the next 25 minutes, we're going to dive deep into 7 fruits that require special attention as we age. These aren't fruits to avoid completely. They're fruits to eat mindfully. And by the end of this video, you'll know exactly how to enjoy them safely while maximizing their incredible health benefits. But first, hit that subscribe button and ring the notification bell because this information could literally add years to your life. And drop a comment below telling me where you're watching from. I love connecting with our Senior Healthline family around the world. Now, let's get into something that might shock you. Here's what most health advice gets wrong about seniors and fruit. It treats everybody the same. But the reality is your 65-year-old digestive system, your medication routine, and your metabolism are completely different from when you were 30. The fruit that gave you energy in your younger years might now spike your blood sugar. The citrus that boosted your immune system might now interfere with your heart medication, and those high-fiber fruits that once kept you regular, they might now cause uncomfortable bloating or digestive distress. But here's the beautiful thing. With the right knowledge, you can navigate these challenges and still enjoy nature's candy while supporting your health goals. Today, we're covering 7 fruits that deserve extra attention in your meal planning. For each one, I'll tell you why it requires mindful consumption after 60, the specific health considerations you need to know, practical strategies to enjoy it safely, and better alternatives if needed. And remember, this isn't about restriction, it's about optimization. Ready to become a smarter fruit consumer? Let's dive in. Fruit 1, grapefruit. Let's start with a big one that catches many seniors off guard, grapefruit. Now, grapefruit is absolutely packed with vitamin C, fiber, and powerful antioxidants. It's been linked to weight management, heart health, and even cancer prevention. Sounds perfect for seniors, right? Well, here's where it gets complicated. The medication interaction issue. Grapefruit contains compounds called furanocoumarins. I know it's a mouthful, but these compounds can dramatically affect how your body processes medications. We're talking about a 2 to 5 times increase in drug absorption for certain medications. If you're taking statins for cholesterol, drugs like Lipitor, Zocor, or Mebacor, grapefruit, can cause these medications to build up to dangerous levels in your bloodstream. The same goes for certain blood pressure medications, anti-anxiety drugs, and even some antihistamines. The blood sugar consideration, while grapefruit has a relatively low glycemic index, it's still a significant source of natural sugars. For seniors managing diabetes or prediabetes, timing and portion size become crucial. A whole grapefruit contains about 16 grams of sugar. That's something to factor into your daily carb count. Smart consumption strategies. If you're on medications, have a conversation with your pharmacist or doctor before making grapefruit a regular part of your routine. Many seniors can still enjoy grapefruit, but timing is key, often consuming it several hours away from medication times. For blood sugar management, consider having half a grapefruit with a protein source like Greek yogurt to slow sugar absorption. Better alternative, if grapefruit interactions are a concern, oranges provide similar vitamin C benefits with fewer medication interactions, though you should still check with your healthcare provider. Fruit 2, bananas. Now, I can already hear some of you saying, really? Bananas? Yes, really. And before you click away, hear me out because this might be the most important section for many of you. Bananas are nutritional powerhouses. They're loaded with potassium, vitamin B6, fiber, and natural sugars for quick energy. They're convenient, affordable, and delicious. But for seniors, They require some strategic thinking. The potassium paradox. Here's something most people don't realize. That famous potassium in bananas can actually be problematic for certain seniors. If you have kidney disease or reduced kidney function, which affects about 15% of adults over 60, your kidneys might struggle to process excess potassium. High potassium levels can affect your heart rhythm and cause muscle weakness. If you're taking ACE inhibitors for blood pressure or have been diagnosed with any level of kidney disease, your potassium intake needs monitoring. The blood sugar reality. A medium banana contains about 14 grams of sugar and 27 grams of total carbohydrates. While the fiber helps slow absorption, bananas still have a moderate glycemic index of around 51. For seniors with diabetes, this can cause noticeable blood sugar spikes, especially if eaten alone. The digestive factor. As we age, our digestive systems slow down. The high fiber content in bananas, while generally beneficial, can sometimes cause bloating or constipation in seniors with sensitive digestive systems, especially if fluid intake is low. Smart consumption strategies. Choose bananas that are less ripe. They have lower sugar content and more resistant starch, which is better for blood sugar control. If you're managing blood sugar, pair banana slices with almond butter or add them to protein smoothies to slow sugar absorption. For kidney concerns, work with your healthcare provider to determine your safe potassium intake levels. Better alternative for lower sugar options with similar convenience, consider small apples or pears, which provide fiber and nutrients with less impact on blood sugar. Fruit 3 grapes. Grapes are nature's candy, and that's exactly the problem for many seniors. Don't get me wrong. Grapes contain powerful antioxidants like resveratrol, which has been linked to heart health and longevity. But they also present some unique challenges for the over 60 crowd. The sugar concentration challenge. Grapes are essentially little sugar bombs. A cup of grapes contains about 23 grams of sugar. That's nearly 6 teaspoons of sugar in what many people consider a small snack. Unlike apples or pears, grapes have very little fiber to slow down sugar absorption, leading to rapid blood sugar spikes. Here's something I see all the time: seniors mindlessly snacking on grapes while watching TV or reading. It's incredibly easy to consume 2, 3, or even 4 cups without realizing it. That could mean 60, 90 grams of sugar in one sitting, more than some desserts. The skin of grapes contains compounds that can be difficult to digest for some seniors. This can lead to bloating, gas, or stomach discomfort, especially for those with sensitive digestive systems or conditions like IBS. The choking hazard reality. For seniors with swallowing difficulties, whole grapes present a choking risk. The smooth, round shape and firm texture can be problematic, especially for those with dentures or reduced jaw strength. Smart consumption strategies. Practice strict portion control. Measure out a half cup serving rather than eating from the bag. Pair grapes with protein or healthy fats. Add them to a small piece of cheese or a handful of nuts to slow sugar absorption. For swallowing concerns, cut grapes in half or choose other fruits with safer textures. Consider freezing grapes for a slower eating treat that naturally controls portion size. Better alternative. Berries provide similar antioxidants with much less sugar and more fiber. A cup of strawberries has only 7 grams of sugar compared to grapes, 23 grams. Fruit 4, dried fruits. Now we're getting into territory that surprises many seniors. Dried fruits, raisins, dried apricots, dates, dried cranberries. They seem like healthy snacks, right? They're concentrated nutrition. Well, yes and no. The concentration problem. When fruit is dried, the water is removed, but all the sugar remains concentrated in a much smaller package. A quarter cup of raisins, which is easy to eat in a few handfuls, contains the same amount of sugar as a full cup of fresh grapes. We're talking about 24 grams of sugar in what feels like a tiny snack. Because dried fruits lack the water content that helps slow digestion, they can cause rapid, dramatic blood sugar spikes. For seniors with diabetes or prediabetes, dried fruits can be particularly problematic Many of my viewers have told me they were shocked to see their blood sugar readings after what they thought was a healthy snack. Dried fruits are sticky and cling to teeth, creating perfect conditions for bacteria growth. For seniors who may already have dental challenges, gum disease, or dry mouth from medications, this sticky sugar exposure can accelerate tooth decay and gum problems. The hidden sugar addition. Many commercial dried fruits have added sugars on top of their natural sugars. Dried cranberries, for example, are often loaded with extra sugar because cranberries are naturally quite tart. Always check labels carefully. The concentrated fiber in dried fruits can cause digestive distress, bloating, gas, or diarrhea, especially if you're not used to high fiber intake or if you don't drink enough water. Smart consumption strategies. If you enjoy dried fruits, limit portions to 1-2 tablespoons and pair them with protein or nuts. Choose unsweetened varieties when possible and read labels carefully. Soak dried fruits in water for 10-15 minutes before eating to restore some water content and slow digestion. Consider using small amounts as flavor enhancers in oatmeal or yogurt rather than eating them alone. Better alternative, fresh berries provide similar sweetness and nutrients with much more water content and fiber, leading to better blood sugar control. Fruit 5, pineapple. It's tropical paradise in fruit form, sweet, juicy, and packed with vitamin C and unique enzymes. But for seniors, this tropical treat requires some. The enzyme factor pineapple contains bromelain, a powerful enzyme that can actually be too powerful for some seniors. While bromelain has anti-inflammatory properties, it can also increase the risk of bleeding, especially if you're taking blood-thinning medications like warfarin, aspirin, or other anticoagulants. The acidity issue. Pineapple is quite acidic, which can trigger or worsen acid reflux, heartburn, or GERD, conditions that become more common as we age. The combination of natural acids and enzymes can irritate the esophagus and stomach lining, especially when eaten alone or on an empty stomach. The sugar content reality. A cup of fresh pineapple contains about 16 grams of sugar. While it also provides fiber, the sugar content can still impact blood glucose levels, particularly when consumed in large portions or as juice. Many seniors notice that pineapple makes their mouth tingle or feel raw. This is actually the bromelain enzyme starting to break down proteins in your mouth tissue. While not dangerous, it can be uncomfortable and concerning for those with sensitive mouths or dental issues. Beyond blood thinners, pineapple can potentially interact with certain antibiotics and sedatives, affecting how these medications are absorbed or metabolized. Smart consumption strategies. If you're on blood-thinning medications, discuss pineapple consumption with your healthcare provider. Eat pineapple with other foods rather than alone to buffer the acidity and enzymes. Choose fresh over canned when possible, as canned pineapple often contains added sugars. Limit portions to half a cup and pay attention to how your body responds. Better alternative. If you love tropical flavors, try papaya, which is less acidic and contains different enzymes that are generally gentler on the digestive system. Fruit 6, cherries. Cherries are antioxidant superstars and have been studied for their anti-inflammatory properties, particularly for conditions like gout and arthritis. Sounds perfect for seniors, right? Well, mostly yes, but there are some important caveats. Sweet cherries are higher in sugar than many people realize. A cup of sweet cherries contains about 18 grams of sugar. While they also provide fiber and nutrients, the sugar content can add up quickly, especially since cherries are easy to overeat. Here's something interesting. While cherries can help reduce gout attacks in some people, they can potentially trigger them in others due to their natural sugar content. Fructose, even from natural sources, can increase uric acid production in susceptible individuals. The sleep medication interaction. Tart cherries are natural sources of melatonin, which is why cherry juice is sometimes recommended for sleep. However, if you're taking sleep medications or other drugs that affect your central nervous system, the melatonin in cherries could potentially enhance these effects more than intended. cherries contain sorbitol, a natural sugar alcohol that can cause digestive upset in sensitive individuals. This can lead to bloating, gas, or diarrhea, especially when consumed in larger quantities. The oxalate content: cherries contain moderate levels of oxalates, which can be a concern for seniors with a history of kidney stones. While not as high as some other fruits, it's worth considering if you're at risk. Smart consumption strategies: stick to reasonable portions, about 10-12 cherries or half a cup. If you're using tart cherry juice for sleep benefits, start with small amounts and monitor how it affects you, especially if you take other sleep aids. For gout management, work with your healthcare provider to determine if cherries help or hinder your specific situation. Choose fresh or frozen over dried to avoid concentrated sugars. Better alternative: if you're looking for anti-inflammatory fruits with lower sugar content, consider berries like blueberries or blackberries, which provide similar antioxidants with less sugar. Fruit 7, melons. Let's wrap up with melons: watermelon, cantaloupe, and honeydew. These summer favorites are refreshing, hydrating, and seem perfectly healthy, and for the most part, they are. But there are some senior-specific considerations. Melons have a high glycemic index but low glycemic load. Confusing, right? This means they can cause quick blood sugar spikes, but because of their high water content, the overall impact might be less dramatic. However, for seniors with diabetes, this variability can make blood sugar management tricky. Bananas, melons are high in potassium. Cantaloupe, in particular, contains significant amounts. While potassium is generally beneficial, seniors with kidney disease or those taking certain medications need to monitor their intake carefully. While the high water content in melons can help with hydration, it can also cause issues for seniors with urinary incontinence or those trying to manage nighttime bathroom trips. The timing of melon consumption becomes important. Melons digest very quickly and can cause digestive upset if eaten with other foods that digest more slowly. This can lead to bloating, gas, or stomach discomfort in sensitive individuals. The rough, netted skin of cantaloupe can harbor bacteria like Salmonella or Listeria. For seniors with compromised immune systems, this presents a higher risk than for younger adults. Smart consumption strategies: eat melons alone or at least 30 minutes before other foods to avoid digestive conflict. Wash all melons thoroughly before cutting, even if you're not eating the skin. For blood sugar management, pair small portions with protein or eat them after meals rather than alone. Consider timing: avoid large portions before bedtime if nighttime urination is a concern. Monitor your individual response as tolerance varies significantly among seniors. Better alternative: if you want the hydrating benefits without some of the concerns, cucumber or water-rich vegetables might be better options for some seniors. And there you have it, 7 fruits that deserve mindful attention in your senior nutrition plan. Remember, this isn't about fear or restriction, it's about empowerment through knowledge. The key takeaways: first, work with your healthcare provider to understand how your medications, health conditions, and individual needs should guide your fruit choices. Second, portion control and timing matter more as we age. Third, pairing fruits with proteins or healthy fats can help minimize blood sugar spikes and digestive issues. Most importantly, don't let this information overwhelm you. Start with 1 or 2 adjustments that feel manageable. Maybe that's checking with your pharmacist about grapefruit interactions, or practicing better portion control with grapes. Your body has served you well for decades. It deserves the best nutrition you can provide, and now you have the tools to make that happen. Here's what I want you to do right now. First, if this video helped you understand something new about senior nutrition, give it a thumbs up. It helps other seniors find this valuable information. Second, subscribe to Senior Healthline and hit that notification bell so you never miss evidence-based health guidance designed specifically for your needs. Third, share this video with a friend or family member who might benefit from this information. We're building a community of informed, empowered seniors, and your sharing helps us reach more people. Finally, I want to hear from you. Drop a comment below and tell me, which fruit surprised you the most? What questions do you have about senior nutrition? What topics would you like me to cover next? Your engagement helps me create the content that serves you best. Until next time, this is Senior Helpline, reminding you that aging well isn't about luck, it's about knowledge. Stay informed, stay healthy, and I'll see you in the next video.